introduction.
Okay. Okie dokies. So I'm noting that it is the right time. Ms. Giddens needs her medications. So I'm going to go ahead and I'm going to have her MAR pulled up. So I pulled it up, and right now she needs lisinopril. So lisinopril 5 milligrams. So I'm going to go ahead and pull her lisinopril. So lisinopril, I know that these come in 2.5, so I'm going to need 2 of these. And since this is an oral medication, I'm going to go ahead and pull my supplies. I need a paper cup and a water cup for Ms. Giddens. So a water cup, and then I'm going to verify and do my first check as I'm pulling this out of storage. I'm going to see that I have lisinopril 2.5. So she needs 2 tablets for 5 milligrams. So that's good. I'm also going to note lisinopril is a beta blocker, so I need to make sure I do a pre-assessment, make sure I look at her heart rate and her blood pressure. So her vitals were taken recently. She has a blood pressure of 182/90 and a heart rate of 76. So both are appropriate for her to receive her lisinopril. So before I touch her, before I get this prep, I'm going to go ahead and do hand hygiene a second time. So I'm going to just leave her medications in the packaging for right now, in her cup, and I have her this prep. Since I'm going to leave it in the packaging, I don't have to do a label for it at this point in time. And so that means I'm ready to go. I'm prepped to go into their room. Hey, Miss Giddens. How are you doing?
I'm good.
Good. So I'm here with your medications. You just need your blood pressure medication right now.
Yeah.
Okay. And always got to ask, what? Could you give me your name and your date of birth?
Georgia Giddens, blah, blah, blah.
Perfect. Okay, and I'm going to know that matches the MAR. I'm also going to double check though with the scan wristband. Do you have any allergies that you know about?
No.
Okay, perfect, and that matches her chart. And scan is good. Okay, so right now we've done our rights where I have right patient, right time. I've checked right medication, right route, and right indication with her pre-assessment. And I will do right documentation at the end. And right dose, and because she's getting 5 milligrams. Okay, so I'm going to go ahead and pull this back up on the MAR. So my second check was preparing that medication. So as I was preparing it and putting it into her little cup, I was checking it, and once again for a second time noting that it is 5 milligrams in her little cup. So we've had her first check as I was pulling it out of storage, second check as I was preparing it in her little cup, and now my third check as I will be administering it. So as I'm putting it in this cup, I'm going to go ahead and scan. So the dose I'm giving, she is pulling up, she needs 5, so I'm giving her 5 milligrams. I'm going to change that on her documentation because I have 2.5s. I'm not going to touch this pill as I'm putting it in this cup. Perfect. So once again, third check. Lisinopril 2.5, lisinopril 2.5, so she's getting 5 milligrams orally. And I scanned that and double checked it by the MAR. Tried her pre-assessment, no allergy. Okay, before I give you this, I'm going to sit you up a little bit. Okay, I'm going to give you a sip of water just to see. and to make sure that goes down all right.
Yeah.
Okay, perfect. Okay, I'm going to give you these medications. This medication is just for your blood pressure. Give this medication now. Okay, here's a little bit of water. Perfect. Okay. So I'm going to hang out with you just for a minute to make sure that while I'm doing my documentation, I want to make sure that that medication doesn't drop your blood pressure too much. You tell me if you start feeling dizzy, lightheaded, or confused.
Okay, I feel fine.
Okay, so I've got my documentation, 5 milligrams. My assessment date, she was hypertensive. Okay, I've done my right documentation. How you feeling?
I feel good.
Okay, so I'm going to make sure you got your rails up, bed in lowest position. Okay, if anything happens, if anything, you have your call light right here. If you start feeling different, okay, and I'll be back by to check on you in just a minute, okay?
Okay. That was great.